Well, we're talking about some significant numbers here. 1 in every 8 children has asthma. It's a chronic disease of the airways, and the symptoms get worse as the weather cools. With us today is Dr. Richard Molteni of Children's Hospital and Regional Medical Center. Doctor, good to have you in here right now. I know this is the busy time of year for you.
It is, Brad.
If you will, can we briefly describe what happens when a child is suffering with asthma?
With asthma, I think the first thing you'll see as a parent, well, first, what happens to the child is that the airways, the breathing tubes, really get swollen. They get red, they get inflamed, they develop more mucus, and the airways tend to constrict.
So,
and what you see with that really is a child who's working a little harder to breathe, is coughing, bringing up mucus. That's what you'll see.
How does a parent know that they're just struggling with some symptoms, or perhaps they're having a full-blown attack?
I think a big difference between a child who has a cold and is coughing and a child with asthma is that a child with asthma, anytime they get up and move, you're just going to notice that in itself will produce a cough, and a cough that they can't seem to stop. Their normal activity patterns will decrease. Where before they were running around the room, they get up, move 2 feet, sit down again. They're not sleeping. They're waking up coughing at night. Those are probably the best signs for you and I to know that this is significant now.
Okay. What are some of the triggers that parents should keep their eye on this time of year?
Right. Well, there's the big triggers, and the big triggers are anything that gets into the airway that will irritate it.
We've got the list right here, so we can kind of go through them quickly.
I think that's wonderful. So colds and viral infections, so this is the time of year when that, as you can hear from me, where that happens. And those don't produce asthma, but they're triggers. They're things that cause that airway to constrict and get inflamed. And then others are cigarette smokes, pollutants and irritants in the air.
Will irritate the situation even more.
Absolutely. Changes in weather, which we'll see a lot. And for some kids, exercise induces this irritation of the airway.
So what should someone do if they believe a child is having an asthma attack? What's the protocol?
Well, the first thing is if there's a serious attack, you need to call your physician or go to an emergency room. But if you're worried about how I can prevent it in the future, you really want to, first of all, find out what it is that are those triggers. Everybody has a somewhat different trigger.
So you're saying get tested?
Get
and
tested,
have the child tested?
Absolutely. First, get tested. And we can help determine what it is. Second, you can do things around the house that really are helpful and useful. You don't want, for example, feathering down pillows. You want to avoid cigarette smoking around the child. You want folks, if they are going to smoke, always to be outside. Cover the bedding, pillows and mattresses in plastic so you can clean it and it keeps the allergen content down. Wash the bedding weekly in hot water, keeps the house mite content, which is a big allergen for kids, down. And if you need, you can even add filters such as high energy particle filters to your house. And if you have problems with other pests and cockroaches, get rid of those for sure. Those are big irritants.
Busy time of year. Thanks for the advice, Doctor. We appreciate it.
It's always a pleasure. Thank you, Brad.
Dr. Richard Molteni there from Children's Hospital.